The staffing shortage is hitting local hospitals hard, especially when it comes to the emergency department. KVU's Emily Goodell tells us how Yakima Valley Memorial Hospital has the busiest ER in the state, and it's worse right now than it was during the height of COVID.
Yakima Valley Memorial Hospital is at capacity, and they're using the emergency department for the extra patients. But 19 out of 24 ER beds are already full.
That means that almost every bed has somebody who doesn't belong in an ER. And so the only way you can take new patients in is you have to see them in hallway stretchers, or you have to move someone that is in a room out into a hallway.
Part of it is the triple-demic, a spike in COVID, RSV, and flu cases all at once. It's also an influx of patients who, when COVID hit, didn't go to the doctor for minor problems and now have major ones.
So not only do you have the volume problems, but you're not seeing sprained ankles and earaches right now. You're seeing people with multiple medical problems who need big workups with a lot of testing, and then a lot of them needing admission. You don't have a place to put them.
And just like how COVID forced patients to delay primary care and they ended up sicker down the line, a lack of funds has forced hospitals to defer maintenance and delay capital improvements, leading to bigger issues.
You're going to pay your staff first. You're going to kind of keep the lights on and keep supplies coming in. But at some point that starts to catch up with you. And you have equipment that breaks down frequently. And that again creates stress.
Which hasn't helped ease the pressure on healthcare workers who have been leaving the profession in droves.
We've lost a lot of people just from the kind of moral and mental trauma of having to work through the pandemic and see all those patients come in and all the families torn apart from the effects of the pandemic.
They're training existing staff for new things and working with schools to get new talent, but say the situation won't improve in the long run without additional funding for healthcare and a change to the environment that's been making people leave. But you can help in the meantime by not going to the ER unless it's an emergency.
If you make an appointment with your primary care doctor, even just go to an urgent care clinic, they'll get you in quicker. You won't have to sit in a waiting room. You won't be exposed to a lot of that stuff as much. You won't be exposing other people to that stuff. And you'll be relieving some of the congestion on the system for people who really need the emergency department.
In Yakima, Emily Goodell, KVU Local News.
The hospital says it's going to get worse over the next month or so as they are expecting to see another surge in respiratory illnesses from the holidays.